We are good to go.
Thank you. Good morning, everybody. I want to welcome you to the Health Subcommittee public hearing with the agencies today. It's like, I don't know where I am anymore. And I want to welcome everybody, and I want to ask my co-chair. First of all, I want to thank all the people that participated last night. I was lucky I was not on the last phase of it, but I understand it went to about 11:30 last night. And I'm so appreciative of all the people that have chipped in and done a fabulous job. And I hate to burst your bubble, but tonight's the night, guys. Tonight's the night. Everybody wants to talk about DMHAS and DDS and everything. So guess what? We're doing about 250 is what we got tonight, Madam Administrator. She left.
74.
Can we shut it off?
Off now, I promise you. Shut off.
Okay, thank you. 274. So you guys do the math, and then we'll talk about this afterwards. But right now we have, first I have my co-chair. I want to say good morning to my co-chair if she has anything to say.
Good morning, everybody. I think we should just get started. It's a pleasure to see you all. And again, thanks for everybody kicking in yesterday. I think this system is working out really well.
Yeah, I do too. I like it a lot. I don't see any of our rankings on, but I'm sure they will show up very soon. But because of timeframes, I want to get right into Department of Mental Health and Addiction Services and Nancy Navarrete.
Thank you so much. Good morning, everyone. Good morning, Senator Austin, Representative Walker, and distinguished members of the Appropriations Committee. I am Nancy Navarrete. I'm the Interim Commissioner of the Department of Mental Health and Addiction Services, and I appreciate the opportunity to testify on the Governor's Bill 5037, enact adjusting the state budget for the biennium. I have here with me Cheryl Aurora, who is the DMHAS Assistant CFO, Colleen Harrington, who's the Deputy Commissioner, and Mary Kate Mason, who is our Legislative Liaison and Senior Policy Advisor. You have my testimony in front of you, and I understand that you prefer to move quickly to questions, so I will give an overview of the proposed adjustments that affect DMHAS. Senator Austin has her hand.
Senator Austin?
Whenever you get to questions, that's all. I was just putting myself in the queue.
Oh, okay. Okay. Just jumping right in there.
Right. Never early, too early. Okay.
No.
So to start, the governor's budget demonstrates a strong commitment to adult behavioral health through significant investments all along the continuum of care, which addresses gaps in the system that were exacerbated during the pandemic. And we've been hearing a lot about that. And I will provide examples of those investments. So the budget enhances the state's substance use service system by adding 25 positions and other funding for the implementation of the SUD waiver, which I think you've heard that presentation, and that will allow Medicaid members with opiate use disorder and other substance use disorders to receive medically necessary treatment services at the most appropriate level of care. The budget also provides $2.5 million for funding for additional individualized community-based services. So that's for individuals who have received hospital level of care and are ready for discharge, and also funding for long-term services and supports, which are also community-based services. Also funded are contractual obligations. So 60 West Nursing Home, DMHAS portion of the rebid for the ASO through the partnership, the Behavioral Health Partnership, increased costs for a food vendor for our LMHA in the southeastern part of the state as their previous supplier went out of business. And then moving to ARPA dollars, the governor recommends $36.5 million in ARPA dollars for adult behavioral health, including $2.4 million to implement a peer support model for people in mental health crisis in the emergency departments, similar to our substance use model that's so successful. $6 million to support 24/7 in-person coverage by our PMP operated mobile crisis teams. $4 million to enhance respite bed services to build capacity for our forensic population. So we will be able to do forensic competency evaluations in the community. So folks will not have to go to Whiting Forensic Hospital, and also additional restoration to competency activities for repeat offenders of misdemeanor only crimes. And those beds will increase from 3 to 15. Additionally, 2.8 million will fund wraparound services for 150 individuals who will be getting housing vouchers through DOH, and also funds diversity training and telehealth equipment. Very exciting news for DMHAS is that the governor is committing an additional 35 million in braided funding, so 16 from ARPA funds and 19 million in IT capital bond request funding for implementation of a new EHR. So we're primarily on paper now. This will be a huge step forward for us in terms of record keeping, improved quality, efficiency, and safety for our population. Lastly, this budget for the department includes reallocating $7.4 million and moves 43 positions for the IT centralization. So in summary, this budget represents a real healthy investment in adult behavioral health that we have not seen in a long time. So happy to take any questions you may have.
Thank you, Commissioner, and thank you for that. I just want to ask you, as a favor to all my committee members, please don't use the alphabet. So when you said EHR, would you say that, please? So that
electronic health record. Thank you so much for the reminder.
Because, yeah, I will interrupt you if any of the members, because everybody's not familiar with those things, so I don't need to go onto that. I just have one question, and then I'll turn over. Can you explain to me the SUD waiver and what the services that are going to be made available under that waiver?
Sure, and I have
waiver, Tony SUD.
That's what I said.
I know.
What I said.
Substance use disorder waiver.
Oh, okay, sorry. Thank you, Kathy.
So we're also lucky to have our in-house expert, Colleen Harrington, on today's conference call. So I will start off, and certainly Colleen, jump in if I miss anything. So historically, for substance use or psychiatric services that have beds, anything greater than 16 beds, we have not been able to bill because per federal law. So we have state funded or grant funded all of those services in Connecticut. This waiver opportunity lifts that ability. So when we applied in the fall, now we are waiting for CMS to get back to us. It will allow us to bill through Medicaid for those services and receive back a federal match on the state dollars, which allows us to then infuse those dollars back into the system. And if you see on the report from OFA, it's basically 25 million in revenue and almost the same that gets embedded into the services. So it kind of raises the bar in terms of what we will expect from our providers, adds additional staffing. It requires folks to offer many pathways to recovery under one roof, as well as connection to physical healthcare services. Colleen, did I miss anything?
So, okay, I very good. What are the services?
So everything detox, residential, so both our 30-day residential and our 60-day residential programs. I won't use all the acronyms, but the American Society for Addiction Medicine, ASAM, has certain standards for each level of care. Everything from withdrawal management, which we used to call detox, to intensive residential services. So all of those services now will be billable under Medicaid.
And so for the facilities that we have already out there doing these types of things, are their requirements going to change, or is it just that they will be able to tap into Medicaid billing? And do all our facilities, I'm assuming, have Medicaid, have ability for Medicaid billing? And Do me a favor. I'm going to ask everybody to please mute yourself so that we can hear the conversation. Please. Thank you. So existing programs that are out there will be able to tap into this, even if they've already got billable opportunities through Medicaid. This expands their billables. Okay. So who is it that who did you say has the standards that are expected? You said
American Society for Addiction Medicine, or ASAM. You may have heard that term, ASAM. So
Okay.
ASAM has a very clear standards for each level of care. In order for a person to be admitted to, which is similar to now, it's not a huge leap, but people will be evaluated by the ASO and the provider to make sure that those services are medically necessary, whether it's withdrawal management, intensive residential, straight residential, pregnant and parenting programs, etc.
Who is the ASO?
Beacon Health Options. But we will also be working with ABH, Advanced Behavioral Health, and they will help us credential and monitor the facilities as well. So we'll be working with both ASOs.
Thank you. Senator Austin.
Thank you very much, Madam Chair. Good morning, Commissioner. My understanding is that this is the agency that handles problem gambling also?
Correct.
Okay. So have you seen an increase in the usage of the programs that you manage under problem gambling?
I think it's too early to tell because sports betting is so new, but we will definitely monitor those stats and follow the data as that rolls out.
The reason why I'm asking is because that's what I thought also, because it's not been around long enough to see an uptick.
Correct.
But the hotline used for this has indicated that they're seeing an increase in calls, but they have not sent us the data to say what those calls are. And they said at the meeting that some of their calls were customer service for the vendors.
Yeah.
And so I think that, that we need time to evaluate this issue. Would you agree with that?
I would agree with that, Senator.
And so can you send or bring to the subcommittee or send through Susan Keene the number of people that we see using the programs historically relative to problem gambling, and then indicate whether or not you have seen an uptick at all in problem gambling and the use of the resources relative to problem gambling? I would really appreciate that. So we can actually put this to bed, because it's being touted around that there's this huge expansion. And if we're not seeing an increase in the use of the programs, where are we seeing this huge expansion? That's my interest in this. Thank you.
And we do have an infrastructure already for treatment. So we cover the entire state. We have, we fund programs regionally to address problem gambling. So I think we're prepared.
Thank you very much. Because they've also said that you've seen this huge expansion, but they don't see us needing any more programming. They say we have enough programming. Well, that doesn't make any sense. If we're seeing a huge expansion and we don't need any more programming, what is the, it doesn't make sense to me. And I'm really trying to delve down into finding out what the issue is.
While we track on the data, as you suggested, that won't prevent us from initiating health promotion and prevention type programming to get ahead of it. So
that would be great.
Yeah.
And if you could let us know what you would need to do that, that would be helpful. Thanks so much. Thank you, Madam Chair.
Thank you, Representative Abercrombie.
Thank you, Madam Chair. Good morning, Commissioner. Good morning to your team. Thank you guys for being here. So I'm going to do speed dating here. On the second page, where we talk about the ARPA dollars for the mobile crisis services for case management. On both of those, could we get utilization numbers? Do you have any? Because I know it's new, But if we're going to be doing any expansions, I want to see what that looks like.
Sure. So current numbers you'd like
Yes,
to see
please.
baseline? Okay.
Yes, please, ma'am. And then under the respite beds services for forensic population, could we get some more detail? Who do we contract with? Where are those beds? How many beds do we have? That would be really helpful. And then I will leave with this. Under the ARPA funding for supportive services to accompany new housing vouchers. Is this sort of in line with what DSS is doing with the CHESS program, which is where they do the housing vouchers and then do the wraparound services?
It's similar, but this is a grant model. So it's our traditional supportive housing model that we've had for years that's been very successful. And so that pairs approximately, depending on the person, it costs $7,000, $7,500 a year to wrap those services around people who have the vouchers. And it really helps people be good neighbors. It helps them be successful in independent living situations.
I agree. I think it's the way to go. And I'm thankful that Medicaid is finally understanding that housing is such an important component to any recovery, right? But if you could give us more details on that, even like breaking it down for the 7,000 and how we see this transpiring, that'd be great. Thank you, Madam Chair. Thank you, Commissioner.
Thank you. Thank you, Representative Abercrombie. Next, Representative Dillon.
Good morning, and it's great to see you today. Thank you.
Good to see you.
I have a couple of questions, and I'm sure more will come up. But as people, we're expecting a lot of people tonight. But if you could provide an analysis for the work group of how your conversations are going on in the Behavioral Health Partnership on the substance abuse disorder waiver, which I'll refer to as SUD now that I've said that. But if you don't have to do it today, because but for follow-up, and there is some kind of confusion among our members about how all this mobile crisis is going to fit together and where the coverage is and who is providing the after hours, so that if you could walk us through that. And there are new initiatives as well. I know that's redundant, new as an initiative, but that would be very helpful. And also, could you provide us with an update on the military support program? There was a failed attempt to eliminate that program a couple of years ago, but I think the compromise was to preserve services for the people who were in it, who were in the Guard and so forth, who were experiencing family issues on return from theater. And there may be a lot of reasons why there are some triggers out there for some of those families. And it would be great if you could give us an update on what that's happening. That would be great. Thank you very much.
You're welcome.
Thank you, Madam. Representative Dathan.
Thank you very much, Madam Chair, and nice to see you, Commissioner. Just wanted to follow up on some questions I've asked in the past regarding prevention dollars for substance abuse. So what kind of investments are we looking at? Has there been any changes or updates to the dollars being spent for educational programs for cannabis prevention?
Thank you for the question. So in terms of cannabis prevention, we will get a percentage once the dispensaries are up and running. DMHAS will get an allocation based on those sales, and we would reinvest those in prevention. We have also gotten a lot of block grant dollars that targets prevention and substance use disorder and substance misuse, also other areas like vaping, tobacco use. So those are all included in what we do at a baseline, and this will just add the cannabis prevention. We have a small media campaign running now that is kind of gives the facts of the law and what happened in Connecticut. And then we will be rolling out a larger campaign to address all the issues related to legalization of cannabis. And we will then also track that data as we will with the gambling data as things move forward.
So can you bring to the work group the dollars that you're investing in these areas and where these programs are being run? And just remind the working group what the percentage is going forward, because I do think, I'd like to know where we are now before the dispensaries are up, because I think this is a critical time to make sure that we educate our young people about the use of cannabis and the issues around that. So if you could kind of illustrate where we are now, where we plan to be, the programs that are getting affected. My second question has to do with the electronic records. Are we doing a sort of off-the-shelf system, or what is the development of that sort of program? I see there's 10 million in for current spend and then 19 million for capital investment. I know capital investment is not our lane, but I'd like to get an understanding, and if you don't have the details today, just a little bit more about how that will work and what kind of system we're using. Is it specifically developed for our state, or are we using one that other states are using? And what sort of savings do we see from this initiative? Thank you very much.
Sorry. So we are in the process of a confidential RFP bidding process. So we haven't signed on the dotted line with any particular vendor yet, but so more will be forthcoming on that.
I'm sorry, can you explain to me what is a confidential bid?
So people have applied, certain vendors have applied to the RFP and submitted proposals, but we haven't contracted yet with any one vendor. So until that contract is signed, it's not disclosable.
But okay, I got that, but it was put out to bid. When did that RFP go out for the bid for that contract?
I believe it was over the summer. Was it over the summer, Mary Kate?
I can get you the exact date of when we sent that RFP out. It was a public RFP on the DAS.
Okay, could you send us the copy of the RFP that was sent out for that?
Absolutely, no problem.
Okay.
And
thank you.
hopefully that will quantify the dollars and how you come up with the estimates. I mean, my more view is we think it's going to cost, 19 million capital, 10 million out of operating. But my more concern is it's a bigger exercise than we think, and it's going to cost us more money. And I really want to get a good understanding of the sort of ROI on that. So if we can bring that, that would be great. Thank you, Madam Chair.
Excuse me, madam, what is ROI?
Return on investment.
Okay.
So I want to know, I'm sorry, alphabet soup here in appropriations.
Yes, I know, but
yes.
we all do it, but if we try and be conscious of it, it helps it spreads the knowledge. So
I appreciate it. Thank you.
I got Senator Austin already reprimanded me. Okay. Representative McCarty.
Yes, thank you very much, Madam Chair, and welcome, Commissioner Navarrete, and thank you for your report. I was just wondering if you could bring to the working group a little more information about supports at the hospital, the peer model support that you reference. I'd like to just know a little bit more about that. I think it's so important, and good to see that there's more work being done with the mobile crisis services. So anything that you can bring to us to enhance our knowledge there. The question may have been asked, but I wondered who the private providers were that you referenced on the mobile crisis services. So anything to enhance that knowledge would be greatly appreciated. And then the last part was on the telehealth services, the equipment piece, some more information about where I know that's a a very important initiative that we really maximize our telehealth services, but I was just curious about what that was for the equipment piece.
Okay, so that
Okay.
will be used for clients who may not have access to equipment now. So we may have it on the state side, or our private providers have, been up and running, doing telework, telehealth. But some of our clients don't have access to that. And so this will enable them to have access. And in terms of the PMPs involved in mobile crisis, it's our core LMHA providers for the most part. So providers you're familiar with: USI, Rushford, Intercommunity, CMHA, CHR, Communicare, which is Bridges, NBH Care, South Central Crisis, which is not an LMHA, and Danbury Hospital, which is not an LMHA.
Right, I'd appreciate that. And then if you could just amplify a little bit how you determine how many individuals still need the equipment, because I know in other departments we've been working on assuring that everyone has the appropriate access. So I'm just trying to be helpful to just find out how many we can determine are still in need of the equipment so that they can avail themselves to the telehealth services. Thank you.
Thank you.
Thank you. Representative Rest.
Thank you. Thank you, Madam Chair. Good morning, everybody. Commissioner, thank you for being on. It's been a while since I seen you in Waterbury, but it's good to hear you here and good to see you. My question is more pointed towards serving the Hispanic population and the Hispanic community, especially services in Spanish. And number one, and number two, can your department break out the number of different minority organizations that you partner with when it comes to getting your mental health message out? Because I think that it's important, because I think that those that we're trying to reach may or may not be part of this social media world that we're in, and interested in what you've done in with radio and the Spanish media, and trying to reach those minority communities that have been kind of in the shadows, if you will.
Mhm. Well, happy to provide more detail in the work group, but I can tell you all of our primary media campaigns are run in both English and Spanish. So on social media, we have it's like a dual campaign, so both in Spanish and English. And we have a Latino project that I know Rep. Dillon is very interested in. We have over $5 million invested to bring in bilingual staff. That's been in operation for years. And the funding has remained consistent. So it infuses dollars to bring on those bilingual, bicultural staff to help across the state.
Thank you, Commissioner. And when you factor out those dollars, are you able to actually target the dollars into minority communities, or you're not that, it's not broken down that way?
It's by agency. So for example, the Hispanic Clinic in New Haven, and it's infusing bicultural, bilingual staff into our provider systems so that folks can have access. So it improves access for everyone.
Thank you, Commissioner. Thank you, Madam Chair.
Thank you, sir. Senator McCord.
Thank you, and good morning, Commissioner. I just wanted to follow up with Representative Reyes' questions. When you're partnering with nonprofit organizations, I'm sure you do a lot of work with nonprofit organizations. When you come into the working group, can you identify the nonprofit organizations that are operated by the BIPOC community? I think it's very important that when we try to get these services out, not that just, I think we have to go beyond just providing dollars in communities, because that doesn't necessarily get to the right people or the right organizations in those communities that get the service done and get the work done. So I hear a lot of commissioners say we're pouring money here or there in these specific communities, but if the right organizations are not getting access to that capital to serve those communities, then we're back and we're at square one. We're doing the same thing we 20 years, the last 20 years, and then nothing gets done. So I would like to know what agencies, because I know it's important, because the state of Connecticut they takes this information, they have to chronologize it in order, because at the end of the day, there are programs, and every community needs to be served. And from my understanding, this administration, they do see color, and color ranges from black, white, and what the most important color, what I've learned, is economics in dollars. And I want to know, how are we spending those dollars, not just in the community, but with the organizations that are run by the people who were home from the BIPOC community? Are they getting access to dollars, and are they doing a great job? So I'd like to know that when we have our work. Thank you.
Sure. I can just quickly say that. I'll give you an example. We have a very successful program that started in New Haven, but has since expanded to other communities. It's called Amani Breakthrough, and it's targeted to African-American communities and really addresses substance use through that cultural lens. So I can bring information about that program. For example, we have many partnerships with faith-based organizations to amplify our message and to be culturally.
And I appreciate that, and I hear that, that's the buzzword that I hear people say. We always use faith-based organizations. If we've been using faith-based organizations for the last 25 years and we're still in the conditions, then we might need to use some more organizations besides just faith-based organizations. Because unfortunately, everybody in our community don't go to church. Okay, thank you.
Sure. Yep.
Thank you, Senator. Before I go to the second go-round, I just have a couple of other questions I wanted to ask. So sort of on that same issue, I thought it was a very odd number, but funding for diversity training, $139,000. What is that?
So it hasn't been defined yet, Rep. Walker, but we do have a diversity, equity, and inclusion division here at DMHAS, and it's been longstanding. The previous commissioner, when she first came to DMHAS, was involved in that division of the department. And so we have a long history of diversity training, diversity, equity, inclusion training. And so I would turn to my content experts to really advise me as to where that money would be spent.
I'm sorry, so I didn't hear you because somebody was talking. I'm sorry, the 139,000 is for what? You don't know yet?
We don't, the program hasn't been developed yet. So that money has been earmarked for DMHAS for this purpose. And I will turn to my content experts to advise me as to what kind of programming should be included, what kind of training for the staff we could add to our catalog that we are perhaps have gaps in. So more to come on that.
So this is a big question mark right now. Okay, interesting. Then the other question that I had on the mobile crisis services that you're talking about, could you also give us the providers that you are targeting with those funds too? We'd like to know who is going to be receiving those dollars. Senator Austin.
Thank you very much, Madam Chair. Commissioner, do you know if DMHAS was involved in the original tobacco board that decided where up to $12 million was dispersed from?
Mary Kate, do you have that history?
I believe we were. I can go back in time and find out particulars if you're interested.
I am interested because we do have that as one of our top priorities to reestablish the Tobacco Fund Board with up to 12 million, which was not always spent, but we want to go back in time and have the practice of spending some of the Tobacco Fund dollars on this issue. And so I'd be interested if you could go back in time, Mary Kate, that would be wonderful, to let us know sort of what programs. We did have some information. Our administrator had some historical information, and we have that, but I would really be interested on what you also have so we can blend the two. Thank you.
Thank you. Representative Dillon.
Thank you. Just a quick follow-up on the Hispanic clinic, which actually, it sounds like it's in New Haven, but it disperses dollars to other towns and provides. I guess I wanted to know on the prevention side, following up on Representative Reyes's question, whether that's integrated with, let's say, gambling or any other prevention efforts. If I recall correctly, that's primarily a treatment model.
You're
And
correct.
whether the outreach, the bilingual outreach is in the prevention area as well.
We do have a Latino outreach as well. So there's treatment and outreach.
Okay, if you could provide that for the subcommittee members. And if I recall on the tobacco prevention, which was an extraordinary negotiation, I think OPM held it quite tightly. They were not thrilled with dedicating it to tobacco prevention. And so I think they ended up doing a pretty good job given the way it started. But I'd really be interested in that model too, if we're looking at how it played out. But I think it was, I don't know how much input DMHAS had. I think I remember it being a very OPM kind of thing. But we'll see what the results show. That's great. And I guess I want to second Representative McCrory's sentiment about community-based organizations, although I have a lot of preachers in my district who would not be very happy at a statement that not everyone goes to church. So I don't want to second that part. But community-based organizations to reach out to different communities, that would be really helpful too. And thanks a lot.
Thank you.
Commissioner, you have a lot of initiatives here in your budget that are ARPA funded. We realize that ARPA funding has a cliff. So one of my biggest concerns is the fact that we're probably putting, like, I don't know what the amount is, but about $44 million into services that are going to run out. And I'm trying to figure out how do we sustain these going forward. So I would like, I'd like to have a narrative from you guys on how you are going to sustain these programs going forward, because like for the electronic health records, that has a maintenance cost. For the mobile psych programs, mental health doesn't stop at the end of 25. So those needs are going to be maintained, and it goes on and on. The vouchers, people are going to be homeless. So all of these things that you're doing are things that have a shelf life, and it worries me in that regard. So I'd like to know exactly how DMHAS is going to maintain these things in the coming years going out, and if there's a way that you are going to have a diminished population because of that, then that could be part of the discussion. But I think we all need to feel a little bit more secure about what's going on there. The general assistance managed care, you're moving 25 million approximately out of that into the substance use disorder waiver operation, and providing them, well, you're reducing that because you're saying the substance use disorder waiver is going to pick that expense up. I'd like to understand how that exchange works. In the general assistance managed care, that pool of money is utilized for what purposes?
So right now, DMHAS, so since this is a state funded now, before the waiver actually goes in place, the state has to pay for those claims. So
Mhm.
those claims run through, for lack of a better term, DMHAS. And then that's what that line is for and that's why the 24,000 million comes out, because now the claims will be paid through Medicaid, and that will go to DSS. You'll also see an infusion of dollars in, so you see the 11 million, and that goes into the grants for substance use, and that will fund the uninsured at the same level that the Medicaid claims are paid.
So it would probably be helpful for us to understand of the 43 million that you have in there, what does that pay for? Who does that pay? Because I don't think we quite understand that exchange. And I think that would be really helpful to understand, because if you're moving the population to another funding, but are they getting the same services? And does this cover the services that the substance use disorder waiver is going to cover? And are the providers getting a different rate, or are the providers getting an increase? I mean, if you had heard our testimony, and I hope you're going to listen to ours tonight, you will hear over and over again from providers how desperate they are right now, and how somehow their profit margin is going up in dust. So we need to try and stop the erosion, because Connecticut's going to be a ghost state pretty soon if we don't get our act together in making sure that all these erosions don't stop. So we're all in tune, especially after yesterday, in trying to figure out how do we stop the erosion for our providers in a variety of different ways. So I really think that this conversation we need to hear from you on what you see is the exchange, and how it's going to be beneficial, but how it's also going to be operational for the private providers too. So,
Sure.
so thank you. Representative McCarty.
Yes, thank you very much, Madam Chair. And just very briefly, I'm responding and echoing some of Representative Walker's concerns about sustainability going forward. And we know today, looking at all of the federal enhanced matches and programs, would it be possible at all, just thinking for going forward for that vision, to have an idea of what programs we could be looking at going forward, where we could receive additional federal dollars outside of what we're talking about today with ARPA? I know there are areas that we could probably enhance, that we would still get more federal enhancement dollars back. So just for edification, if there's a way that we could look, because I too hear what Representative Walker is saying, that while we do this and it's good, we need it, it's absolutely essential, but how will we sustain this going forward? I think it's something we need to be forward thinking and get those programs that we know we could be out there applying for additional enhanced funding. I don't know if you can do all that, but thank you.
Sure.
Are there any, excuse me, are there any more questions? Any more questions? Well, thank you, ma'am, and good luck for your hearing today. You'll do great. I know that you'll do great, but I really, I think we're going to have a few sessions with you, because the other thing that I am really interested in, and I know that my colleagues have all called me about it, we want to talk about the opioid dispensaries, and we want to understand what are the things out there, and how can any of these tie in here, and how do we help those dispensaries become part of the community in a positive way. We need that desperately. So we'll wait for you to reach out to us. If not, we'll reach out to you.
Absolutely. Be happy
Okay.
to. Thank you, Rep. Walker. Thank
Have
you.
a good day. Thank you.
You too.
Bye-bye. Okay, so Madam Administrator, where are you? I know you're here listening to us. Who is Mike? Does anybody know who Mike is? Did anybody see the gentleman that was on screen?
We don't know who he is.
Okay, can we disconnect him, please?
Sure.
Thank you. I don't know how somebody got our connection for Zoom, but before anything happens, we want to make sure nothing happens that we would be embarrassed about or anything.
Are we ready for DDS now?
I don't know. That's what I'm trying to find out. I saw Taylor and the baby. Is DDS here? Yes,
Yes, some of them are arriving, but they aren't scheduled until 11. So
I know, but Commissioner Chef is right there. I am seeing his bright smiling face already. Go right ahead, Madam Senator Austin.
Thank you very much, Madam Chair. Good morning, Commissioner. This is Senator Austin over here, and I just want to welcome you to our meeting and leave the floor open to you for a few opening comments, and then we'll get right into questions.
Thank you, Senator. And I'll be brief. I understand time is pressing for all of you. But good morning, Senator Austin, Representative Walker, Senator Minor, and Representative France, all other members of the Appropriations Committee. I'm Jordan Sheff. I'm the Commissioner of the Department of Developmental Services. I've submitted my full testimony in writing and in support of Governor Lamont's proposed budget adjustments. I won't go into the details in my introduction of that written testimony, but I wanted to acknowledge briefly, I have a number of staff who will be joining the call if they're not on already. But we'll wait to introduce them if and when they're needed to assist me in responding. And lastly, last 2 years has been trying. I'd really like to thank the governor, Secretary McCaw, and all the members of the legislature, as well as my colleagues at sister agencies and internal to DDS, who've made it possible for us to survive and thrive and begin to reopen during what has been a very challenging couple of years. And with that, Senator Austin, I will turn it back to you for questions.
Thank you very much, Commissioner. So Commissioner, let's talk about the last 2 years a little bit. We have a new contract with many of the providers for their workforce. And I'm wondering, how is this playing out and what do you perceive in the next year or so as a problem relative to the workforce within DDS in the group homes?
So I would tell you that there is a workforce crisis like we have not seen. The executive directors at our private agencies, my colleagues here at DDS, but it isn't just germane to DDS. I think it's across, if you were to talk to my colleagues at DMHAS and DCF, Commissioner Bai, in terms of early childhood education, schools, hospitals, we're all fighting for the same handful of available employees. Secretary McCaw was integral at a time negotiating a wage package for us that was very generous, recognized across the country as being very generous. And despite that, the impact of the pandemic and the changing workforce, our providers are still struggling. So we're engaged with our providers to try and find ways to remedy that. We're also engaged with the Governor's Workforce Council, and we have money included in our ARPA proposals to try and assist the provider community with retention and sign-on bonuses and things like that to help them with the current workforce crisis. But it is a daily challenge, and it impacts every part of our system.
Well, thank you for that, because I hear from a lot of providers that say that the dollars that were available have not addressed a lot of their issues, in particular around compression. And that while the contract did help out with the bottom line workers to bring them up to a living wage, it is creating some significant pressures on the sort of the continuum of work that's in your group homes. Do you perceive compression as a problem within your group home structures?
I do believe that providers are feeling some of that. However, there was there was not only a lift to the floor at those agencies to create a minimum wage, but the secretary afforded, and this is going back a little while, but I believe a 5% increase for anybody already above that threshold of minimum wage within their organization. So, and I don't believe there was a cap on it, and it extended not just to direct care workforce or managers, but any of their staff within administration. But I am hearing some of the same concerns that you are, Senator. And so I think that providers are struggling, and we hope to engage with them to see if there's other ways that we can look to address that.
Right. So if you could get the data for me, because I'm hearing that they did not get raises. Anything above that bottom line, that they received less than the 4.5% that they received. In some cases, 3%, but not across the board. And so if you could get me that data, that would be very helpful. And lastly, the group homes themselves are saying that they appreciate getting increase in dollars to help out with wages and benefits. They're not getting any dollars to help out with that roof replacement or the fixing the boilers or windows. I think that that's also a very big problem, because all their dollars come from us. Essentially, some of them are have an ability to do fundraisers, but when you're trying to raise $40,000 to do a roof, or $10,000 to put a new boiler in, that's a heavy lift in some areas of the state. Certainly not down in, all due respect to the western part of the state, where there are some deep pockets that might do that. That's not true across the state. And so I think that there was allocated some dollars that were made for bonding. We used to give out bonded dollars to groups. Is that, have you been advocating to address that issue either with more dollars or with an ability to provide some bonded dollars for these groups that are counting on us?
So Senator Austin, we can bring some information, and I'll invite our colleagues from DSS to join us in answering the response. The room and board rates are administered through the Department of Social Services, and they pay for those improvements. I can tell you that I frequently am authorizing those types of improvements, but in terms of how the rate relief happens for providers, when we come to the working group, we will ask our colleagues at DSS to assist us with a clear response.
Thank you very much, Commissioner. Representative Walker, followed by Representative Abercrombie.
I'll wait till everybody else finishes their questions, so go right ahead. Thank you.
Okay, Representative Abercrombie.
All right.
Thank you, Madam Chair. Good morning, Commissioner. Good morning to your team. It's great to see you guys here. Just a couple of quick questions. Can you explain the definition of emergency placements, and how do you come up with a number that fits the 5.6 million in the budget?
So I will ask my staff for assistance on the math. I think that, but in terms of determining what an emergency is, it's a combination of factors that are reviewed on a case-by-case basis. So there's not a definitive litmus test for what defines an emergency or an emergency placement. They're all, as you've heard me talk about for years, we're a very person-centered system, and we look at holistically at a person's life and their circumstances to determine when we make that funding available to them. And we're not an entitlement, so often that is within existing resources. What resources we have limits how many people we can grant emergency placement to. But my CFO, Scott McWilliams, is on the call. Scott, can you help me with the math on how we come to that number?
I'm sorry, John, I just logged on. What number are we talking about now?
I'm sorry, Representative Abercrombie had asked about the $5.6 million in emergency placement money. My assumption is that we have a certain number of people we plan to place and an average cost per person in emergency placements, and that's how we got to that number. But I'm not certain of that, as I said here. So we can, if you don't have that available, Scott, we can respond to that more fully at the working group, Representative Abercrombie.
Yeah, I think we're going to need to get back to that. We'll get back to you on it.
So Scott, what I'm looking for is the definition of emergency placements.
Okay.
And how do you come up with that 5.6 million, right? And is that used? Do we roll those dollars over? Because I know it's probably not an exact science, right? Because you don't know, but I'd like to have more details on that. And that's fine to bring it to the working group.
Okay, we can do that.
Thank you. And then Commissioner, on page 2, around the ARPA dollars, if you could bring to the work group under other expenses, 33 million, what does that mean? Who does that affect? Are those providers? Details would be really helpful. And then under that same line, the employment opportunities and day services, what does that mean, right? Who does that affect? How many? I think the numbers are really important. We're talking about, 33 million, 20 million. I just want to make sure that the money is being spent in the most efficient way. For the day services, is that adult daycare? Do they fall under that definition too, or is that not your agency?
So we don't, Representative, we don't use the term adult daycare. We do have programs that are not day programs that are not employment related. And I know you're familiar with them in your neck of the woods pretty intimately. So those are services provided, what we call DSO, day service options, that are non-employment related day supports. But I'm not familiar with the phrase adult daycare within our service sector.
And then just to leave on this note, if you could add any information about any added technology dollars that might be available. With the ARPA dollars from the last round, DDS, you guys are very generous to a lot of our providers, but there's still providers out there that could use some of that help and some of that funding. So I don't know if when you talk about other expenses, if you're including some more grant opportunities for some of these programs out there. And I think that's it for me. So thank you so much. And thank you, Madam Chair.
Thank you, Representative.
Thank you very much, Representative Abercrombie. Representative Dillon, followed by Representative Dathan.
Thank you, Madam Chair. Good. Good morning, Commissioner. How are you doing?
I'm good, Representative Dillon. How are you?
Okay. I wonder if you could provide for the work group just a breakout of all of the ARPA dollars and how they're going to be used. Obviously, the 33 million kind of jumps off the page, although I suspect I know what it's for, but I'm not sure. OE is always an interesting account, but there's also community engagement. There's other issues going on there. So if you could, there's obviously going to be a challenge, as Representative Walker suggested, about the sustainability of anything we do with ARPA. And so that would be really helpful. Also provide for the working group the current census and per diem of Southbury.
Yeah, we can absolutely provide that information to you at the work group. Census and did you say average age?
Per
staffing, per diem.
Per diem.
Okay.
And then finally, because I know that there are other people with their hands up, there was a very strong testimony yesterday about the rates for dental, which has always been a really important issue for the population served by your department. Do you have an estimate about the access for folks now? And the differential issue was kids versus adults for dental. And as you know, dental is a really big issue for your folks. And are they not getting what they need? And is that something we should be looking at?
Thank you, Representative Dillon. Just two remarks. We'll bring most of that information. First, I want to assure you that we work very closely under Secretary McCaw's direction when looking at ARPA initiatives. to ensure that we were not going to leave future legislature on the hook for picking up a tab for what had become existing services. So in a very large part, I'm sure there are some ongoing dollars, but not a large portion of them. They're time limited innovation type money or systems money. There'll certainly be some minimal ongoing costs, but we were very careful not to include things that would put anybody on the hook to pick up the slack going down the line. And again, under Secretary McCaw's direction. Oral health is overall health for a lot of our folks. So your interest in dentistry is important to me. In addition to having some of the most robust Medicaid dental rates in the country to support our individuals, we continue to operate a number of dental clinics with a high number of chair visits because what Medicaid can provide and the level of care many of the people we support need aren't a real strong match for a number of individuals. So in addition to Medicaid utilization, we will also bring data on our clinic usage, where a lot of people who can't get good routine care through public dentistry can get it through us. And we'll bring that to the work group.
That would be great. Thank you very much. Thank you, Madam Chair.
Thank you, Representative Dillon. Representative Dathan, followed by Representative Walker.
Thank you, Madam Chair, and nice to see you, Commissioner, today. Really appreciate your testimony and all the work that you and your team have done for the last 2 years. It's been vital to keep everybody running. I wanted to drill in a little bit on the day service options that you sort of talked about earlier. You know, I'm hearing, I'm not sure if it's anecdotally or if we have evidence that a lot of the programs that were running pre-pandemic were 6-hour days, and now we're getting less. And I think this is due to the staff shortages that we're seeing. I'd like to get an understanding of some sort of trends, maybe if we can compare pre-pandemic numbers to where we are currently. One, in terms of the number of folks being served, and also talking about the number of agencies that are providing these vital organizations and services to folks. And I know that, you know, there's a huge discussion when we talk about this and talking about rates and how that's affecting these programs. And I understand that in Massachusetts, they're addressing this creatively, and would like an understanding of what we are doing in our state to ensure that folks that are receiving these services continuing to get good quality day programming post-pandemic, and making sure that we're not totally relying on ARPA dollars to get there, and how we're addressing that. It's a big question, I know, but if you can address that a little bit for my first question, I'd appreciate it.
Yeah, we can bring information to the work group. I obviously don't have utilization rates pre and post pandemic at my fingertips at the moment. I think that there are multiple components to the drop in services in the first year, just out of health and safety, right? We were protecting people from potential exposure, knowing that pre-vaccination, our individuals were more susceptible to adverse outcomes from COVID than the general population. I'm pleased to share that we are doing much better since vaccination, on par with individuals that we're no longer the most vulnerable. The unvaccinated are the most vulnerable, and many of the people we support are doing quite well. But I think as the workforce issue became more prominent, while we had developed mitigation strategies and containment strategies for managing the health risks, it was tough to get people back to work and to fill all those slots. And I do believe that providers, out of necessity, not out of want, have had to limit access to certain services because they simply don't have the workforce to fully provide those services. And they've been creative in the way that they've done that, offering some virtual services, offering shorter days, offering alternative days. And lastly, to your question, and I'll try and have a little more definition to this because I've mentioned it before. Periodically, there's a rate study done for agencies like DDS, and I believe we are in the queue for one in this coming year. I have not been at DDS at a time where a rate study was done, so I'm not familiar with the details of what that will entail, and a lot of that is left to the state Medicaid agency, but I do know that my staff have been in discussion with them about that. And I believe some of what Massachusetts has implemented was a result of rate study completed there in the last 2 years. But I would have to check with Jane, the commissioner there, around the impetus behind that rate change. I know that she and I had talked before the secretary had as the secretary was settling the wage negotiations here, because as we are a bordering state, we don't want to always be pilfering from one another along those borders, and we share a long border with Massachusetts and a lot of staff who would travel for a differential in pay. So I wanted to make her aware that we were doing that so that we didn't drain their service system to fill hours only to have them leapfrog us on the other side, and we play the game a second time. But we can follow up on that for you.
Yeah, no, certainly we do see that in the area where I represent in Fairfield County. We see a lot of people coming from New York to come work in Connecticut. And I think, part of the reason, from my understanding, is the quality of services in Connecticut. And we offer a lot more rewarding work for the folks coming from New York. So I want to make sure that we don't lose people on either side. My second question really has to do with the agency. And I know you have a lot of potential retirements in your group, and we've talked about a little bit in the past about the CREEPS report, how we're doing. I would like to understand how you are looking at making sure that you fill the post. It seems like your organization, and this is only my fourth year on this committee, is kind of a little bit slower to hire. And I'd like to understand what we're doing to make sure that we fill these necessary roles, because I am very worried about what the agency and how we're supporting our safety net if we're losing some of our top people. Thank you.
Thank you, Representative Dathan. I share your worry, but I also know that I'm surrounded by a pretty remarkable team, and a lot of staff at DDS are lifers. They've been here, many of whom have been waiting for opportunities for higher levels of management and leadership to become available so that they could advance, and I'm looking forward to them doing so. We are utilizing, we're strongly partnered with our friends at DMHAS on the recruitment efforts, and we're losing staff across all ranks, both at leadership and management levels, as well as at direct care. As direct care is essential for us in 24-hour operations, that was my priority late fall into winter. As we have begun to make significant strides there, we're pivoting, but with not a lot of time left. We're utilizing temporary worker retirees. A number of our staff are going to take retirement, but are willing to come back and assist. And there was latitude granted also so that we can hire staff ahead of an anticipated vacancy for key roles, so there can be some cross training, and we plan to utilize and leverage the latitude granted. I've been in state service now almost 10 years. It's the first time that broadly we've been able to attempt to do that. Both the combination of TWR and the overlapping of staff prior to retirement. The one thing that I'm very careful about is that in our attempts to fill those positions, we don't drain our private provider network, who's got leadership issues of their own following 2 years of very challenging work, and a group of executive directors who have begun to exit, and residential managers, program managers below them. So we have to be delicate about the way we do that, because an attempt to stabilize DDS as an agency could destabilize our private provider network, and they account for more than 90% of our services. So we're going to go about it thoughtfully and planfully. My staff are used to working extra hard after the last 2 years, so hopefully this will seem like a slightly lighter lift than those initial year of the pandemic, but we'll cover for each other, and we'll put in the hours, and we'll ensure that the quality of our services and the health and safety for those we support is paramount.
Great. Can you bring to the working group the kind of analysis of what these numbers look like, so that we can just have a better idea where the potential retirements are and where we need to be focused in on? Thank you so much for your testimony, and thank you, Madam Chair.
Thank you. Representative Walker, followed by Representative McCarty, followed by Senator Minor.
Thank you, Madam Chair. And Thank you, Commissioner, for coming before us. I'm going to kind of zero in on right now quickly on your budget yourself. Specifically, I noticed in your budget you have a very huge increase in OE of $31 million. And I know you probably would immediately say to me, well, that's because that's the home and community-based services funding. But that home and community-based service funding is ARPA funding. So if it's ARPA funding, it should go on another line, which is ARPA Rescue Plan Act, where the funding goes. So what it does is, in a couple of years, you're going to have a huge deficit in your line of OE because the funding goes away, and it should be accounted for in ARPA funding. So that starts to make me feel even more concerned about what this home and community-based service reinvestment plan is. So I really would like to get a lot more information. I'd like to understand, what is the plan? What exactly is this this home and community-based services reinvestment plan, and what is DDS's component of it? And I see that there are some management five durational project managers and administrative assistants, et cetera. How do they fit into your scope of staffing, and what is their life expectancy? I hate to say it like that, but you know, how long are they going to be in the project? I don't want it now, because I need to really feel this expansion, because it says it's $56 million going into the general fund. And I'm glad to hear that you have a close relationship with OPM, because OPM is very good about scrutinizing ARPA funding. And I'm sure that you have a well flushed out plan that we look forward to talking about. So that, I hope, is going to be part of our very first conversation that we have going forward in the subcommittee. So thank you, and thank you for answering our questions and talking to us about. Oh, one more. You have 21 people that are going into the IT the
optimization.
IT, the technology system. Can we find out what these 21 people do, and how are you going to operate without them in your system? I know there's been some now changes in the discussion about, well, everybody's not going to go to the executive branch. Some will stay back and they will be reporting to the executive branch. But I know that as you go into some of your services, you depend on those IT for billing and for everything else that goes on. I just want to see how it's going to work for you in your agency. So I look forward to having that information. So thank you, sir. It's good to see you.
Good to see you too, Rep. Walker. Thank you.
Thank you.
Thank you, Representative Walker. Representative McCarty, followed by Senator Minor.
Yeah, thank you very much, Madam Chair, and welcome, Commissioner, and thank you for submitting your testimony. Mine's very brief. I just wondered, and Representative Dillon may have touched somewhat on it, if you could bring more information to the working group on the enhanced community engagement opportunities. I'd like to see, I know throughout the pandemic, we really have to focus on more socialization and bringing our individuals with disability back to doing more fun activities. So I would appreciate seeing some of that work. And then just the $5 million in the governor's budget for increased camp improvements and infrastructure. That $5 million, I know, and part of that will go to our Camp Harkness here in Waterford. So I think that's so valuable. But when I read that normally you can't use any kind of funding in your department for infrastructure improvements. So just if you could maybe bring some information how you handle that, and so we're more aware of what the needs are as far as those concerns go, because I know they do impact respite care as well. So I was just curious about how we can stay on top of that.
Thank you, Representative McCarty. And I want to be clear, the publicly operated camps have been eligible as recipients of funding through bonding and other means for investment. I think the reference around, we have not had an ability to invest in infrastructure costs or capital costs in the privately run camps. And there are a number of them. There's one up in the northwest corner that LARC works closely with. There's Horizons, there's Creaser, one operated by Camp Horizons, one operated by Oak Hill, and I may be missing a couple. Typically, we only fund the service dollars for the staffing at those camps. They've really taken it on the chin the last 2 years because they weren't able to operate in the first year, and when they have been able to operate, they've had greatly reduced capacity. The result is that some of their fees have allowed them to make some of those investments, and the more patrons they have, the more fundraising they can do for some of those investments. But they're now lagging a number of years behind, and those camps need upkeep to be safe and to be healthy, particularly with our new concerns around proximity, density of how close people are living together, ventilation systems in the cabins. So this is the governor's way of trying to help advance what are, as you've identified, there are golden opportunities for families and individuals with intellectual disability to have some really meaningful opportunities to connect, to recreate, to get respite. And so we really are encouraged by the governor's recommendation in his budget and hope for your support on that. But we'll provide details when we come to the work group.
Right. And thank you very much for that clarification. I figured there was bonding somewhere for the infrastructure needs for our various purposes in the DDS. So thank you for that.
All set, Representative McCarty?
Yes, I am. Thank you.
Thank you. Senator Minor?
Thank you, Madam Chair. Good morning, Commissioner. So I was listening to your response to Representative Dathan, and quite honestly, I was left a little flat. I had a conversation earlier this morning with another employer in the healthcare system. There isn't anybody in the state of Connecticut that isn't facing a problem trying to find employees. I think to Representative Dathan's point and question, I'd like to think that you could bring some information to the work group that would illustrate how far out of the box you folks are willing to think to attract employees to the state of Connecticut. It's a worse than a zero-sum game if we poach each other's employees within the state of Connecticut. The only way this is going to get better if we become the destination for people in the healthcare community, whatever the branch of it is. And so maybe it's just me. Maybe I lack the confidence that I should have in government, and I hope you'll prove me wrong. But if you wouldn't mind bringing to the subcommittee some of those out of the box ongoing efforts that are going on within your agency to replace what I think we all have known for years are going to be a significant number of retiring employees. And in fairness to you, I think some people have come to that conclusion earlier than they would have because of COVID. And so if you could be willing to do that, I'd appreciate it.
Thank you, Senator Minor, and we will be ready to do so.
Thank you.
Senator Minor, are you all set now, sir?
At the moment, yes, thank you, ma'am. I'm resting up for the long day ahead.
Very good. I think we all are. So, Commissioner, where are we on Southbury now?
I don't have the census in front of me. We're approximately 132 people still living there. We've condensed a number of cottages and reduced some of our other expenses as a result of some of the efficiencies, but our census is 132, I believe.
The empty buildings that are on campus, what are you doing with them? Are we just mothballing them? Are we taking them down? What are we doing?
My understanding is that we've remediated some of the hazardous conditions and have otherwise mothballed them, but there was some money invested in remediating, I believe, asbestos and lead prior to mothballing them. We have had on again, off again conversations about demolition, about surplusing some of the additional property. We work closely, my directors at Southbury work closely with the town of Southbury around some of those potential future opportunities, and we have discussions with the first selectman. And but I don't have any definitive plans around those existing structures at this time.
So do you know how many empty buildings we have on Southbury now?
I can furnish that number to you, but I don't know that number off the top of my head.
Because I can foresee this is the standard state practice, not necessarily your state, not your practice, but a standard state practice is to hold these buildings. And we did the same thing down here in the Norwich State Hospital, where buildings were left to rot. And I mean, they were gorgeous buildings in their heyday, but they end up being a huge liability relative to possible fire hazards from people who decide to visit these empty buildings. And I'm just curious what we're going to do, because I think we should be ahead of the curve on this and not wait to what happened with the Norwich State Hospital and the old Mansfield Training School and some of the other places where we have these old buildings that are not even useful by today's standards. And so if you could bring to the working group the number of empty buildings we have at Southbury, what the plans are for them, and how much vacant land there is up there.
I can do so. I believe we also have, that's a couple of years old, but we have some figures, I believe, available on what it would take to either modernize the buildings to make them useful or to eliminate the buildings so that they're not a liability. But there's a cost to the state either way to do something with those buildings going forward. So we can give you an idea roughly what some of those numbers may look like as well. Where you'd want to invest in either eliminating buildings or reconstituting the buildings for other uses.
And there's a cost to the state to doing nothing also.
I agreed, Senator. Yep. Yep. Understood.
Thank you. Representative Dillon for the second time.
Thank you, Madam Chair, for the second time on Southbury. Historically, we had an eye-popping problem of workers' comp and injury at Southbury. And over the years, spent a fair amount of time at ways to prevent slipping on the floors next to bathtubs, throwing out your back, whatever. I know you were not in state government then, but you were around. The management of injury prevention and of workers' comp, I don't know if they're done together. How much, and the workers' comp has moved in and out of your agency and DAS. Would it be accurate to say it's in DAS now?
Scott, are you able to answer that for me? The location of workers' compensation with regards to Southbury?
Yes, this year it's budgeted in DAS.
And on the issue of preventing injury to the folks who live there and to our state employees, who I expect had some morale issues during the past 2 years if they were working in that building, who would manage injury prevention there? Would that be you? Or is that a function of the workers' comp people?
I think there's multiple layers to that. So some of that is a function of workers' compensation in terms of looking at experience, identifying trends, reporting back on those trends. But the directors and the management team, supervisors and staff themselves have engaged in trying to keep each other healthy and safe in a very large way. There have been some simple improvements out there that eliminated a lot of our negative experience in workers' comp in terms of how we adjust beds, move, lift, transfer people. And those initial improvements have had lasting effect, but there have been other efforts based on other experience. I can get a little more detail for you, both on the experience trends and workers' comp at Southbury, and some more information on how the programs around worker safety are administered, but I don't have that available for you at the moment.
No, I wouldn't expect you to today, and but it is important in terms of all kinds of things. You know, the claims have a long tail, even if we're not worried about the safety of the people that are in our care, but we do. No, I know that things like rugs and whether or not the surface of the floor in the bathroom is good and all those things. So you could provide us with information about where the injuries are taking place and what kind of a program you have to prevent it as long as the building is open. That would be great. Thank you very much. Thank you, Madam Chair.
Thank you very much, Representative Dillon. So, Commissioner, you were talking earlier about a VISTA issue and a working group. Can you give me some more information on the working group? Who is on it? What working group is it that's working on the VISTA issue?
Working on the VISTA issue. I'm sorry, Senator. I'm struggling to recall.
Okay.
Were we talking about it earlier today or earlier?
Yes. Yeah. Earlier today.
I'm sorry. I don't know if any of my staff. I've lost track of what that conversation was about.
That's all right. We'll talk about it further at the working group. We can talk a little bit about that. So anyways, are there any other questions or comments? Seeing none. Thank you very much, Commissioner.
Thank you.
My understanding, Representative Walker, is that Commissioner Giuttani is tied up in exec noms, and she is being asked some detailed questions by the members of exec noms, and will be a little bit late. And so I'm wondering if we could just go into that little tutorial we talked about.
Yeah.
So,
Well, we don't have a lot of members on, but yeah.
well, they can share it with each other.
Okay.
And we have enough number of people that were on last night. So, so many of us have, and so all of you from DDS can leave, and all of you are staying, and we'll be waiting for DPH to sign on. So just so you all know, last night there were a couple things that Representative Walker and I noticed that we think might make it easier for you to see the list of people that's on. So usually when we have the public hearings, we both sign up the participants or the panelists numbers, and the panelist also has another tab on attendees. So that way you can see who is waiting to come into the meeting, and you'll be able to see that some people are not there at all. If they're not in the panelist line and they're not in the attendee line, they're not there. So you don't have to ask the administrator where that person may happen to be. What's also good about it is it shows you who's on the phone. The phone number shows up in the attendee side. That gives you that number. And our great group of staff has numbered everybody by their number in that they were given when they signed up to testify. So that way you can see who's waiting, who has not shown up. And you can also see when you're missing somebody that might sign on later that we have to call on that missed their time frame, so that we can keep the earlier numbers moving along. And I just wanted to sort of let you know that component of it, because it does give you that additional information. It'll have a panelist, and then there's another tab called attendee. So that is very, very helpful. Last night, Representative Felipe had a really good mechanism of letting people know, when their time was up. That's something that I thought was helpful. I think he had a timekeeper helping him too, but, I think that that's something that we're looking at, and Zoom is also looking at figuring out a time mechanism to put on these calls too, because apparently other people are asking, other states are asking for that, so it's not just us. So just sort of wanted to pass that along to you so that you would know that. Again, it's very helpful having everybody take an hour. It makes the meeting seem to flow a little bit better. So I just wanted to sort of get that. Madam Administrator, did I miss anything?
No, I think you touched on everything tonight. Is going to be.
Taylor, do you want to say anything too about the meetings? Do you think we got everything?
Yeah, I think that's it. I just think we do our best to communicate throughout with the representatives or legislators that we have their phone numbers to let them know if we need to pause to find any phone numbers. I think that was probably one of the bigger hurdles.
So just so you know that if you give your number to them, your cell number, they can text you while you're chairing to ask any questions that need to be asked. And that way it's another helpful mechanism for us to be able to get information back and forth. All right. Thank you, Taylor.
Thank you.
Tony, anything?
No, I just think that the most important thing that we ask everybody tonight, because of the abundance of people that we have, that everybody stick to the 3 minutes and be apologetic as much as you can, but also remind them that the person that is supposed to be coming in at 200 or 250 would like to be seen when people might be awake. So the importance of us sticking to 3 minutes and making sure that it's not personal. We want to hear their message, but they need to make sure that their message is condensed into 3 minutes so that we can move on. And also, for those of you who don't know, the testimonies are predominantly online in appropriations under public hearing. So you have the ability to know the names by the testimony, and then you can go up and look up the testimony that they presented to us. So we have backup methods of getting information if you weren't able to get everything at that one time. And then that's also gives us an opportunity to make sure that if you have more questions, you can follow up with people from their testimony so you know how to get in touch with them. So it's not as if we're just pushing them along. We're trying to give everybody opportunity to express their focus and their interest. And it's hard because everybody wants to talk to everybody for hours and hours. Can't do that because then we get nowhere. And it's important that we try and get everybody an opportunity to speak. So thank you, Madam Chair.
Can I ask a quick question, Madam?
Mm-hmm.
Is there any requirements of people having to be on camera during their testimony?
No.
No, it's nice to have. I mean, some people I think are concerned about putting their face on. I would hope that people would do it because I mean, I want to be. I mean, if we were in the chamber,
exactly,
they'd have to show their face anyhow. So I like to know. I like to see the people who I'm talking to personally, but. I don't know. And I think if you're going to testify, then testify. But
I think that some people just don't have the capacity on whatever technology they're using either. That's the bigger problem.
Yeah, some
people just don't push it, but there's also been some problems in other committees with where the technology was not allowing them to put their face on. So there are different things that are going on with that.
Is there a way to have a timer visible?
No, we've asked Zoom for that, and they're working on the technology. There is no way right now.
I think people meant well last night, but it was erratically applied. And it's very easy to lose track of that time. And I don't know how I'm going to do it, but it would be great if there was a way to do it. It looks kind of official.
You could talk to Zoom and tell them we want it done. The General Assembly's been talking to Zoom they meet regularly with them on updates and have not been, that Zoom wants to do it, they can't do it right now. They don't have the technology right now.
Oh.
Anybody from DPH do we have an update on the commissioner?
Good morning. Good morning. This is Deputy Commissioner Aaron. The commissioner is still in approach, but they should be taking a break shortly. Yes. Yes, they should be taking a break shortly.
Okay, thank you.
Tony, I'm turning it back over to you.
No, don't go. Oh, brother. We're gonna get really punchy by tomorrow.
I know. I like that 8 o'clock in the morning meeting after 270 people.
Yeah. Look, Doug's yawning for us already.
No. I know, I'll be right back.
Yes. Oh.
Okay, the commissioner is waiting to be let in right now.
All right, thank you.
Is that the phone number? We only have a
615-364.
I have a different phone number in the waiting room, and that's the only thing I have in the waiting room right now.
I believe it's her. She's trying to be let in.
I just got in. I'm here.
Okay, great.
Thank you, DCR.
I don't see you.
I'm gonna let in the number. We'll see.
While we're waiting, Representative Kennedy.
Oh, thank you, Chairman Walker. So I'm actually sitting also in on the executive noms meeting, and there's still 2 more hands raised. So just want to let you know that.
Oh,
okay.
So she's not ready yet.
The next speaker just started his line of questioning, so it's going to be a few more minutes.
Okay, then
for sure. I just want to give you that update.
Thank
Rep.
you.
Walker, if you'd like to begin, though, DCR and other members of the DPH team are here.
Oh, no, we'll wait. We'll wait for the commissioner. We'll wait for the commissioner. Thank you.
Madam Chair, if we could just take a moment to identify that number then, if it's not the commissioner.
What was that number?
It is 860-705-4327. If you could just let us know who you are. You're unmuted, I believe.
Hello?
I think they just hopped off. So, all right.
Okay.
Thank you.
By identifying them, sometimes they decide they don't want to talk.
Tony, do we want to start with the deputy commissioner because it's
What time is it? It's
11:45 and they're supposed to be done at 12.
Yep.
I don't know that we can wait.
No, I don't think we can. Representative Kennedy, is she still being questioned?
I believe she is finishing. She's just wrapping up some questions. I don't see any other hands raised unless somebody puts a last minute one up.
Okay, all right, excellent. All right,
I
then
see no. So
we'll start with Deputy Commissioner Aaron, and then we'll go from there. Okay. All right, Deputy Commissioner Aaron, go right ahead.
Okay, good morning, Representative Walker, Senator Austin, and all of the esteemed members. Thank you so very much for being patient with us this morning. The testimony for the commissioner has been submitted to you, and it's very personal to what the commissioner wanted to discuss. So I am going to go directly to the proposed budget adjustments, if that would be okay.
That would be great.
Okay, so the governor's proposed fiscal 2023 budget for DPH appropriation accounts total 142.5 million. Of the only, and the changes are somewhat significant. We had a net reduction in our IT with the centralization of about 1.5 million for about 16 FTEs with the centralization. That process is happening as we speak. The Department Administrative Services have, consolidated. The next item that we had on our list had to do with an addition of 1 FTE for the Solnit Children's Center for their licensure. We'll be starting to do that. And then we did get an additional FTE for the related to taking care of the private wells. So there was a plus up in that area. In other expenses, it's fairly flat, a slight increase of about $3,000. There was also an increase related to the per capita grants for local health of about 244,000. So that's a plus up. The other area that there was a plus, we got $1 million to work on tobacco prevention. So we're pleased with that, and that is supposed to happen in 2023. We continued all the other spending has been level. We don't see any decreases anywhere else with the governor's budget. We have gotten an additional, these are the big ones that are related to about $91 million related to ARPA funds. We will receive $70 million for lead in homes so that we can do work with families with children with high lead levels. And I know that there is a governor's bill that is related to this, where they're reducing the allowable lead levels in children. We also received, related to workforce for primary care, about $17 million in student loans. This is a huge increase. Our last allocation was $500,000, so we're very pleased with that. Related to community violence and prevention programs, we have had an increase, an additional $1 million related to that. So again, huge increases, and we're looking forward to working on those programs. Overall,
You're muted, Deputy Commissioner. You're muted. Deputy Commissioner Aaron, you're muted.
oh, I am so sorry about that. I have been talking nonstop myself.
You were good all of a sudden, and then you got muted. So
I don't know how that. So where did so you did hear something?
We did hear the first part of your testimony. Representative Walker, Commissioner Gittani is also on.
I saw, but I was trying to let Deputy Commissioner Aaron finish since she had started it, and then I was going to turn over to Commissioner Gittani. So Deputy Commissioner Aaron, I think you were up to the community violence prevention, and then we can go to the questions.
Okay, great. So this, again, I was finishing up that we got additional funding. We're about $3 million for community violence prevention program. And basically another $325,000 that will be related to our PPE stockpile. So thank you very much, and I'll turn it over to the Commissioner.
Okay. Good morning, Commissioner. Commissioner. I see you.
Hello, everybody.
Good morning. Good morning. Good morning.
I apologize for my delay.
That's quite all right. That's quite all right. We're just trying to keep within the schedule of everybody that's going. I hope you had a good testimony, so we can put that behind you and go on to the next things. I'm going to ask very quickly on this, the ARPA funding for healthy and lead safe homes. Well, Deputy Commissioner Aaron said she thought it was 70 million. We have 50 million. I don't know where the discrepancy might be. It might be an additional 20 million that is also added in there, but the line item says only 70 million. So I think it's it says provide ARPA funding of 50 million in FY23 and then 20 million in FY24. Do you have a plan for that? Do you have a plan for that?
So yes, I'm also of the impression that it was for 70 million. That was my understanding in terms of what it is. And I think that maybe the best way to approach this is Lori Matthew on the call right now, is she? Lori, would you be able to outline a little bit more exactly how we're planning to address and utilize these funds?
Yes, thank you, Commissioner. So as DC Aaron had mentioned, there is a bill that's a governor's bill that outlines lowering the lead, blood lead level number that is in current statute from 20 to 3.5 over a period of years. We know when that happens that there's a lot of work that will need to be taking place. Not only in, as DC Aaron mentioned, helping the families and the children, if the children have to be relocated, if the families need assistance, to help the children is the core mission of what Commissioner Jatani has laid out for us. To make sure what we're trying to work toward is making sure these homes that are harming children today need to get fixed, and they need to be remediated, and they need to never harm a child again. And this money at a high level, we have a plan that's rolling forward to work with local health directors, work through our lead program within our department, which we have a lead program that works mostly on case management right now, as well as data and tracking. We have a lot of information, but we want to focus in on primary prevention measures. So I don't know if DC Aaron, you wanted to add to any to that plan, or?
The one thing I just want to say before I turn it over to DC Aaron is that, there's the change in level will take a lot of work to be, and over time to be able to make those adjustments and roll them out in a way that can help really get rid of or minimize as much of this problem that is kind of hard to imagine to me, actually, that we still have in the state of Connecticut with how far advanced we are. But that this is going to build on the bipartisan infrastructure law work to reduce lead levels based on lead service line removal as well. So this is going to really be attacking the problem of lead from a multifactorial way, and particularly our high SVI communities. So I think that there is work that can be done within homes and in ways that Lori has outlined. And in addition to that, lead service lines, which is a specific separate issue.
Okay, before we go into any more, we would like that brought to the work group. I'd like to understand how you're rolling this out and how people are going to be informed of this, because it's ARPA dollars, so it has a shelf life. And the last thing we want to do is have it sit on the shelf. And the most important thing that I think we can start to do is to talk about realistic timelines and what the expectations are in each one of those phases. So if you could bring us information on that, on the student loan payment, I really am interested in what is the scope of services under the Community Violence Prevention Program. That one I really want to see and hear about, so that we all are understanding what exactly is in your ARPA dollar expectation, so that we don't even have to get into those details, because we've got a lot of people who have questions. So I'm going to go right to Representative Dillon, followed by Senator Austin, followed by Representative Datham. And I don't know, is Senator McCory, is your hand up? Okay, so follow right after Datham, Senator McCory. Representative Dillon.
Good morning, Commissioner, and welcome. I too would like to flesh out a little bit more about the community violence and where you've put it in the budget. And we weren't sure where that was, so that will be a discussion. The second would be to report to the work group on the status of the wastewater monitoring, which I know other states have been using. New York and now Vermont is rolling out one to monitor opioid use in the towns. And the CDC did pick some cities to use for wastewater, but they don't seem to be doing a statewide initiative. So that if you could update us on that, that would be very helpful. I guess the next would be, it's not in the budget, I don't think, but whether or not, how we're learning from the pandemic we just went through, and whether we have any plans to strengthen our genomic sequencing, whether they were either centrally in the health department or in the even in the local health districts, how that would work out. You know that the Delta was discovered because the health district, I think in Dover, sequenced it. It was pretty amazing. And it was, I don't know where we are with that, and that would be really, really helpful. So that's, I'll leave that for now. I see many hands up, and thank you for being here.
Thank you, Representative Dillon. I'm going to take wastewater and whole genome sequencing myself. And then I'm going to ask Susan Logan maybe to talk a little bit about the gun violence that you were
Commissioner?
asking about. Yes.
Commissioner, what she's asking is that you bring that to the work group.
Okay.
Because we're running out of time for our meeting. And
Sorry.
so no, that's okay. So that we can get right to you get all the scope of questions from everybody that will help you in shaping your conversation. Thank you.
Yeah.
Senator Austin.
Thank you very much, Madam Chair, and following along the lines, Commissioner, with the other questioners, can you bring to the group what does DPH think that they can do relative to the workforce problem in healthcare? And much akin to what Senator Minor said earlier, when he said that, you know, if we're going to rob Peter to pay Paul relative to workforce, it doesn't seem to end the situation if we're going from state agency to state agency or hospital to state agency and back again. We need to bring people in from out of state. What is the plan there? How are we going to entice workers to come here? What are we going to do? Because it's clear to me that that we don't seem to have a plan, and I'd like to know if you have come up with a plan to start replacing some of these workers that we're losing, not just in group homes, but nursing homes and hospitals. We are dying on the vine for need of workers, and I understand that this is a national issue. There's got to be ways that we can deal with this, whether we expand upon training programs for high school kids, or we're going to start poaching from Florida or Massachusetts, which I'm okay with, but we need to understand that. And relative to the lead pipes, I believe that you must have an idea where some of this lead pipe issues are, and do you have a kind of a map of the state where we need to start paying attention to that lead pipes? If you could bring that to the work group, that would be also very helpful. And those would be my two questions. Very interested in that. And then if you could bring to the work group the number of small water systems we have that are in trouble. So thank you. Thank you very much, Madam Chair.
Thank you. Representative Dathan.
Thank you very much, Madam Chair, and thank you, Senator Austin, for asking one of my questions regarding the workforce issue. I have a big concern about that, so glad to hear that people are on top of it. My first question is going to be in regards to the new tobacco prevention account. I know Connecticut is one of the only states that doesn't allocate or restrict some of the money that we get for our tobacco settlement towards the tobacco prevention, and that's something that I think we personally need to do. But I'd love to hear what this new prevention account is going to be doing, what sort of programs it's going to be addressing. It's only $1 million, so I get a little concerned. That doesn't sound like a lot of money, and what kind of impact are we going to be able to do? Are we leveraging what other states are doing to prevent tobacco use? And I see vaping is probably one of the big issues that we're seeing. So I'd love you to bring to the work group some more information regarding what we've done historically, what this new amount is going to be for, and what we can get and sort of return on that. My second question for the work group really has to do around the immunization services. I know we have a large amount of money in there, and I just want to hear what we're doing in regards to promoting immunizations. I know I've seen personally a lot more advertisements and other sort of media campaigns around this, but I'd love to get a little bit more information on what we're doing, particularly in our urban cities, because if you look at where we are as a state, the urban centers are the areas that are falling behind in immunization rates. And we need to do what we can to focus resources to make sure, not just for COVID, but for other sort of childhood diseases, that people are getting themselves immunized. So if you can share that to the work group, I know we're low on time. So thank you so much for your time today. And thank you, Madam Chair.
Thank you. Senator McCory.
Thank you, and I'll be very quick. Good morning, afternoon, Commissioner. Quick questions. In SB1, there was a language around health equities, and what are we going to do about health equities in the state of Connecticut? And I don't see any funds allocated for that program. Can you explain to me how you're going to support that program and come up with a strategy around health equities if there's no funding there? And also, can you I want to carry on with my colleagues saying to the working group. I really will learn. I'd like to know more about this lead abatement program. I think it's great, but if you already have such written out, this is a workforce issue. We know where these homes are located. They're mostly located in urban areas. This is an opportunity to diverse our health profession right now. This is a workforce issue. If we can come up with a strategy to do that, I would love to work with your organization to do something around that. I know we had a smaller program in the state of Canada before, but this is an opportunity, a workforce issue and a equity issue. And I would like to work with your organization around putting forth a program that can do two things: provide workforce opportunities for people in those. You said something about SBI communities. I don't know what an SBI community is. You can explain to me after I finish talking, which would be 3 seconds. And it's a workforce. You have an opportunity to do something around equity, workforce, and eliminate lead paint, which is a huge problem. So can you bring that information to their working group? And I still have some outstanding questions that I asked to your office, and I'm waiting for the answer. So lastly, just explain to me, what is a SBI?
Yes, I'll just say quickly, SV as in Victor I, Social Vulnerability Index. So SVI is Social Vulnerability Index. It takes into account a number of different factors related to income, housing, access to a variety of different resources. I can send you a quick slide that summarizes it well, that really identifies who is most at risk for many of the things we're talking about. So this is a term that's often used when we talk about equity and when we're talking about disenfranchised populations.
Okay, so they're kind of similar to marginalized community, versus like the ghetto, urban communities, same terminology.
Same terminology, except
you know who
that,
we're talking about.
Yeah, it's the same terminology, except it's based on actual numbers and things that people calculate.
I get it. I know. Thank you. Are we waiting to hear the working group? Thank you.
Thank you. I'm sorry, SV. What was the V?
Vulnerability.
Vulnerability. Okay, thank you. Representative McCarty.
Yes, thank you, Madam Chair, and welcome, Commissioner. If you could just bring to the working group of some more information about the student loan repayment program and how you envision that will be broken out. And I think we had some questions about who exactly would be included in the behavioral health professionals category, whether that included social workers, just the groups that were going to be included in that. I think that would be helpful to us. So thank you.
Thank you.
Thank you. Thank you, Commissioner. I appreciate you coming back with the answers for our questions and things. And I know it's kind of, you learn by fire, but that's kind of the way we kind of do this in a lot of ways. But thank you very much. Thank you. And thank you, Deputy Commissioner Aaron, for providing us with the opportunity to give our questions and everything. And if there are any issues or questions that you need a little bit more detail from, please feel free to contact the Madam Administrator Susan Keene or Senator Austin or myself, and we'll be glad to give you a little bit more detail on those. So thank you, everybody.
Thank you.
Okay, guys, you got 1 hour and 55 minutes for lunch, and then we start the marathon that's going to be going on until 1 or 2 o'clock in the morning. Yay! So we will all see everybody, all of you up there. Senator McCory, we haven't gotten your hour yet registered on when you.
Is tonight?
Yes, it is, sir. It starts at 2 o'clock, so we need to get your hour in.
I'm probably best served at let's say I go from 9 to 10.
9 to 10.
From
Okay.
9 to 10. Yeah.
Okay, Susan, we're putting you down for 9 to 10. Thank you very much, everybody.
problem.
Everybody have a great afternoon.
Okay.
Thank you.
Thank you.
Bye-bye.
Thank you.
Bye.
Bye-bye.